Hello, I'm Devin Brown, and this is the video for my 2017 Capstone project at the Houston Academy for International Studies. And this is Dr. Pinckney, my mentor at St. Luke's.
Hey everybody.
Dr. Pinckney, do you have a few questions for me that you wanted to ask?
Sure. So first of all, it's been a pleasure having you as my mentee, and I just wanted to ask, what did you learn about emergency medicine during your time with me?
Among the many things that I've learned about emergency medicine, the ones that I can think of most are just the kinds of protocols that go in place when you enter a room, like when you see a patient, like how to categorize them on a specific emergency level and treat them based upon that. And other things, simple things like how to dispose of the materials that you use on the patient, and just how patient care and things like that. Like just watching you, I've learned how to get all of your jobs done while still maintaining like patient care.
Yes, perfect. Outside of school, what's your passion and how do you balance school and your extracurricular activities?
Right off the bat, I would say that medicine is my passion, but I really haven't explored the world of medicine because of my age and things like that. But I would say I love swimming, I like to run track, I love video games. I haven't played in a while because of school and things like that gets really conflicting. But if I could, I would definitely play more video games.
Okay, awesome.
Yeah.
Awesome. Well, that's good to have work-life balance, so that's good to learn now. How do you plan to use this experience to help other students just like yourself?
I plan to let all the other students know exactly how hard it is to get an internship in the medical field, because whatever hospital you go to or whatever doctor you're under, they're going to require you to have some kind of paperwork or some kind of immunizations records to get done, or just some kind of compliance that you have to be within to actually work in the field that you want to.
Right.
Yeah.
Great, good job. And then what did you enjoy about mentorship as a whole?
Oh,
Excuse me.
yeah. My most enjoyable part was just following you around and knowing that I could trust you if any like situation went wrong. And I knew that I was at the same time still learning, like everything that you said just surrounded me in the culture of the world of emergency medicine, and just watching you handle your patients allowed me to like better understand the exact process that goes on. So I would say that's the best thing that I've learned, is learning while also having faith in you as my mentor.
Awesome. We've been an excellent student, and I've really enjoyed having Devin with me. And he's done nothing but make you guys proud, and so we're so happy for him and all of his accomplishments going forward. And now he has a great presentation for you.
Yes. Okay. So for my capstone project, I had a few objectives. My first objective was to provide safe at-home patient treatment, improve emergency and classification and response, educate new mothers on common treatment of non-lethal illnesses, and to create a standard of safety response that can be used at home. So basically my capstone was supposed to be a portable booklet of sorts that people who were not affiliated with the medical field to use to accurately predict and maybe treat some illnesses, or just give a better response to certain situations, only producing better outcomes. And so the project itself, there were only a few requirements: that it had to be easy and portable, the notebook had to be categorized by different emergency levels, and I also wanted it to be color-coded, because like many other things in the medical field, like everything is color-coded by, to increase efficiency, everything is color-coded by words and emergency levels. So if I kept this kind of thing the same from the hospital to the notebook, then people would understand how to use it. And a few obstacles in my place from keeping me from doing that were the flexible design, the durability of the notebook, and the build of the notebook itself. And so my solution to this whole problem is a portable triage notebook. It kind of looks like that on the cover. It's a hard cover, and so it's going to be composed of medical literature, some of the knowledge that I've learned from Dr. Pinckney and others in my experience at my internship, some of Dr. Pinckney's knowledge, and patient care associate Grace Mendoza, who works here at St. Luke's, and a registered nurse named Bonnie Bateau, who also works here. And I'll just compile all of this information and create a booklet that has a lot of the common illnesses that children and adults have. What were the 3 greatest things that you learned from performing your capstone project? I would say working with Dr. Pinckney helped me learn how to effectively organize an emergency medicine system to compose my notebook. Working with Dr. Pinckney showed me new methods of detecting signs and symptoms of bodily harm. And working with Dr. Pinckney helped me learn more about medications, antibiotics, and narcotics, and other medical terminology. And all of these three things basically have prepared me for the future by enveloping me in a culture, a medical culture, that would prepare me for my future life as a surgeon, or what I'm aiming for. And this notebook is going to impact many people because it can reduce the fluctuation of new mothers and young children in the hospitals, potentially saving resources that could be used or even wasted. The pamphlet gives a solid treatment and assessment program that works every time, and it's come from the things that I've seen Dr. Pinckney do when she enters the room, and the things that I've seen other nurses and how they interact with patients. And finally, I want to give a big thank you to Dr. Pinckney for being my mentor and bringing me on board. I understand that I can be a handful sometimes,
Not at all.
and I'm glad she brought me on board. I can have a hug?
Yes. Bye, kids. Study hard, work hard. Good luck to you, okay? Bye-bye.